Good evening, guys. This is H for you all. Talks about caregivers and of dementia patients and the emotional uh, challenges they face. So we're going to go through those tonight for H. So please join me in tonight's discussion for caregivers of dementia patients. Okay. So I'll start now. Caregivers of dementia patients often face emotional challenges, and there are various forms of support available to help them cope. Okay, support groups. Joining uh, joining caregiver support groups can provide a sense of community and shared understanding. These groups often offer a safe space to share experiences and learn from others facing similar challenges. Counseling services. Professional counseling can help caregivers process their emotions, manage stress, and develop coping strategies. Okay, respite care. Temporary relief through respite care allows caregivers to take a break, recharge while ensuring their loved ones are cared for. Educational resources, access to information about dementia and caregiving techniques can empower caregivers and reduce feelings of helplessness. Um, Online communities, virtual forums, and social media groups can connect caregivers with others worldwide, offering advice and emotional support. Okay, next page. Give me a minute, please. Okay, then last page. Mindfulness and stress management. Practices like mindfulness or meditation, yoga, and relaxation techniques can help caregivers maintain emotional balance. Family and friends. Leaning on loved ones for emotional support and practical help can make a significant difference. If you'd like more detailed, specific resources, let me know. Okay, guys. Being a caregiver of a dementia patient is very, very hard. For matter of fact, I've seen where people have to do behavioral modification programs, things like making charts up for their dementia patient and making goals for the end of the week for them to hit, giving them stickers for rewards, or maybe taking them out for like a shopping trip or ice cream or something small for the reward. That makes their life, that makes them shoot for the goal that you set for them. Otherwise, they don't try. You have to give some people like that a goal to reach for. You have to make them want to reach that goal. Give them some sense of accomplishment when they don't have much much to go on. Because dementia patients, they wander if they don't have something to focus on, or they wander off to different places if they're in somebody's home in a facility, it's much easier to control because they have a specific area in the facility to accommodate those folks. That doesn't mean shut them away from the door or shut them behind doors. That means you get people to, that work there, but you have to train them on how to handle dementia patients or memory support folks. Memory with people with memory issues. It just isn't dementia. It's memory issues. It's like Louis Lewy body dementia or Parkinson's disease for that matter, because Parkinson's people also also are affected by their brain dying. You know, sections of their brain die also, just like dementia. So, those folks have to have specialized training to deal with patients like that. So, having in being a person that deals with elderly people and memory issues, you have to have a special knack for that. You have to be in a few, you have to love what you do for that. You have to be in a special mindset for that. You can't just take a person out the street and throw them in with a dementia patient, because the person has to have experience with people. Takes a special talent, which I'm blessed to be one of those people that have that talent for this. So I hold myself pretty, um, I love what I do for people. So it makes a difference for them. I'm happy if I make somebody's small details. I'm a person that handles the small details for elderly people. That makes a difference in their life. If they want to go for a cheeseburger for the afternoon, if I deal with them, I go with them. I sit with them for cheeseburgers, for small little details, because those small little details matter, when they're at that stage. So I just thought I'd do this one for people's FYI. So for now, Gator Wellness, take care, folks.